There have been about a dozen cases of measles in the country so far this year, which is about the total in all of last year. One case was reported in BC over the weekend, prompting health officials to join Chief Public Health Officer Dr. Theresa Tam in urging everyone to get vaccinated before traveling abroad during spring break. Dr. Tam is concerned the global surge in measles activity and a decline in measles vaccine coverage in school-aged children in Canada could lead to an increase in imported measles cases. Joining us now to discuss the steps that can be taken to protect children from measles is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Thanks for joining us.
Great to be here.
Why are we seeing measles cases increase internationally? Are there specific countries that are worse than others in regards to measles cases?
Yeah, I think that's a great question. We are seeing it everywhere at this point and at a much faster rate than we expected. Just as an example, the WHO's European division saw an increase in cases from just under 1,000 in 2022 to 30,000 last year. Global numbers really show that measles cases have increased worldwide. We're about 9 million cases in 2022 and about 136,000 deaths. So some 32 countries had outbreaks in 2022, and that number has gone up last year to 51 countries. So what we're seeing is these outbreaks are really focused on regions where vaccine rates are a bit low and the health infrastructure is not as strong as it should be as well. All of these factors, of course, make it a lot easier to get the disease.
So, what are the dangers associated with measles?
So of all the diseases we immunize against, measles is likely the most deadly. It starts off with a rash, fever, cough, and a runny nose, and you find that more with younger people. But the issue is this infection can trigger respiratory failure, inflammation in the brain, which can lead to hearing loss and vision loss and neurological damage. And in pregnant patients, measles can also increase the risk of miscarriage and premature labor as well. Looking at measles globally, without vaccination, 1 in 4 used to be hospitalized, and about 2 in 1,000 used to actually die from measles.
Wow. And are we also seeing an increase in cases in Canada?
Well, if we look at Canada specifically, you look at 2023, we had about 12 cases nationally. But looking at where we are now, just in the past week, we've seen 17 cases confirmed all throughout the country here. We have 1 case in Ontario. We have about 10 cases specifically in Montreal. So what we're seeing is most of them are involving children. And what we're seeing with that as well is maybe only 3 of those cases were linked to travel outside of the country, meaning what we're seeing is local spread happening there.
Okay, so what do you think are the root causes of vaccine hesitancy in Canada when it comes to measles?
So it's very complex. I think there's a mix of cultural, psychosocial, spiritual, and political reasons here. But really, if you boil down to it, there's really 3 big categories, right? There's a lack of confidence, so lack of confidence in effectiveness or safety or even policymakers. There's a bit of complacency, so a perceived low risk of acquiring the disease. And then there's a lack of convenience, so in the availability and really accessibility and even appeal of the services you have to get vaccines there. So Canadian parents in general have a lot of concerns when we're dealing with the necessity of the vaccines, concerns about vaccine safety, and then the perceived number of side effects. And that's really what's driving a lot of the vaccine hesitancy.
So, what can be done to address the issue of hesitancy to ensure that vaccine rates don't slip and we have a return of measles outbreaks?
Yeah, I think we all have to play a part to help in this. So going back to those 3 issues, lack of confidence, well, this can stem from a lack of trust in healthcare and policymakers. So we all have to work on that trust aspect we have with our patients and trust we have with our constituents. So we're making sure that we're not being dismissive or judgmental here just because their beliefs are slightly different than ours. For the complacency part, I think there's a concern about a perceived low risk of getting the disease. And this is really combated with education pieces, just like you're doing today. So educating the public on the dangers of measles and why it's important to get the vaccine. And finally, we see the lack of convenience. I think we can all agree that healthcare is not exactly the most convenient thing to get these days. So what we will need specifically is targeting those rates, such as immunization clinics, and providing appropriate language options as well for high-risk neighborhoods to just bring down those barriers. So basically, lack of confidence, lack of complacency, and lack of convenience. If we can address those three things, that's the best way to combat vaccine hesitancy.
As always, thank you so much for your time.
Great. Thanks so much for having me.